What if a computer could detect the warning signs of a heart attack years before it occurs? A person may feel completely healthy, have no symptoms, and their ECG may look completely normal. Yet hidden within their medical data, there could be subtle signs that indicate an increased risk for a cardiac event. Today, artificial intelligence is allowing researchers to detect these signs with a level of sophistication unlike ever before. Heart disease remains one of the leading causes of death worldwide. Millions of people suffer from heart attacks every year, many without any prior warning signs. As a result, improving our ability to identify high-risk individuals has become a top priority in modern medicine. And advances in artificial intelligence are providing researchers and scientists with powerful new tools to help better understand cardiovascular disease. But can AI predict a heart attack before it occurs? And if so, how accurate is it? Every year, heart disease is responsible for millions of deaths. The most common form is coronary artery disease. This is when blood supply to the heart is blocked by fatty deposits called plaques. Over time, these plaques narrow the arteries. Sometimes, if a plaque suddenly ruptures, this can trigger a blood clot. If blood flow to the heart suddenly becomes blocked, then a heart attack will occur. The challenge here is that the plaques develop silently for many years. Many people feel completely healthy before it occurs. That's why early detection is so important. Today, doctors look at factors like cholesterol levels, age, blood pressure, smoking history, family history, and weight. These factors are all combined into risk calculators. However, the results aren't perfect. Some people classified as low risk get heart attacks, and others that are classified as high risk don't. No single number can capture a person's cardiovascular health. Researchers have long searched for better prediction tools, but here's what makes AI different. AI can find patterns in large datasets. Unlike traditional systems that follow strict instructions, AI learns from examples. Over time, AI learns to spot these patterns and can tell you which people are more likely to get a heart attack. Researchers are now applying and testing AI for every aspect of cardiology. ECG stands for electrocardiogram and detects electrical activity in the heart. Traditionally, doctors look for obvious signs such as an irregular heartbeat or muscle damage. But AI goes much deeper. It can recognize things that humans may not, subtle changes in the ECG. Modern hospitals use CT scans and other imaging techniques to examine the heart. This produces an enormous amount of the data. Analyzing all of this detail manually can be difficult. Researchers are now training AI to detect many things. For example, plaque volume, composition, location, and the degree of narrowing of the artery. Some studies suggest that these techniques can be used to increase the detection rate of this disease. This may help doctors understand which patients need aggressive treatments and which ones don't. Today, the most powerful use of AI comes from combining different types of information. Anything that influences heart health, including blood pressure, genetics, sleep patterns, health habits, and medications. AI can integrate these into a single predictive model. This gives doctors a more complete picture of the patient. Rather than relying on a few risk factors, AI analyzes all of these factors together. This means that thousands of variables are looked at simultaneously to get the risk factor for the specific patient. AI is now expanding beyond hospitals. Many people now use smart watches and fitness trackers to track their own health. Most of them monitor heart rate, sleep quality, and activity levels. Some of them even record ECGs, and scientists are now exploring whether these technologies could predict heart attacks. Medicine is slowly moving from better treatments to better prevention. This represents a major shift in healthcare. But could AI actually predict a heart attack? This is where things become complicated. AI can identify risk and estimate probabilities. However, it's not able to do several things. It would not be able to predict a heart attack on a specific date, especially if there are unexpected changes in their lifestyle and diet. A sudden surge in stress could trigger a heart attack even if the AI predicts that it's years away. While advances in medicine have helped millions live longer, one major challenge still drives cardiovascular disease around the world: diet. Over the past several decades, people's diet has changed a lot. Now, people consume large amounts of meals high in saturated fats. Excess sodium raises blood pressure. Diets high in added sugars could cause obesity. Stopping these habits years earlier will help people not reach the stage where they're at high risk of a heart attack. There are still challenges and limitations. If the data is incomplete, then their information will also be incomplete. Secondly, many of these AI models function as so-called black boxes. They generate predictions but can't explain how the predictions were made. AI also makes errors, and these errors can have serious consequences. False negatives provide false reassurance, and false positives cause unnecessary stress and anxiety. In the future, AI will become deeply integrated into this field. AI will analyze different scans results. Some researchers are now exploring digital twins. These are virtual computer models that stimulate a person's heart. They can be used to see how the heart will respond before actually trying it on the patient. This technology could be life-changing, and it's a glimpse into the future. Heart disease has challenged doctors for generations because the second that symptoms appear, it's often too late and lots of damage has already been done. AI aims to identify this danger before it becomes too late. In the future, AI will be deeply integrated into medical systems.